Hello, everyone, and thank you for joining our JPAL State and Local Innovation Initiative webinar. We're very excited to be with you today to talk about the State and Local Innovation Initiative, which supports state and local governments in using randomized evaluations to inform important policy questions. I want to start with some brief introductions. My name is Julia Chabrier. I'm a Senior Policy Manager at JPAL North America and the Manager of the JPAL State and Local Innovation Initiative. I'm joined today by Melissa Carney, a professor of economics at the University of Maryland. Melissa is also one of JPAL's affiliated professors, as well as one of the co-chairs of our JPAL State and Local Innovation Initiative. And I'm also joined by Corinne Weaver, the Director of Research and Evaluation at Cafeterias Fort Worth. Melissa and Corinne are joining us here today to discuss their partnership on an evaluation of Stay the Course, an innovative program aimed at increasing degree completion among low-income community college students. I want to start with a brief overview at the agenda for today's webinar. I'll start with an introduction to JPAL and the State and Local Innovation Initiative and talk about feasible opportunities for using randomized evaluations to learn about the effectiveness of programs and policies. Then I'll turn it over to Melissa and Corinne, who will share their experience in partnering on a randomized evaluation. And I'll close by sharing more information on how to apply to the initiative before opening it up to Q&A. If you'd like to ask a question, please feel free to submit at any point using the chat box, which is on the right side of your screen. I also wanted to note that this webinar is being recorded, and we'll post the recording and slides on our website, povertyactionlab.org/state-and-local. I wanted to start by sharing some background on JPAL and talking a bit about why we decided to launch the State and Local Innovation Initiative. For those of you who don't know, JPAL stands for the Abdul Latif Jameel Poverty Action Lab, and we're a research center based in the economics department at MIT. JPAL's mission is to reduce poverty by ensuring that policy is informed by scientific evidence, and we do this through three core activities. First, we support evaluations, and in particular, randomized evaluations or randomized controlled trials of programs and policies aimed at alleviating poverty. Second, we conduct policy outreach both to connect policymakers with researchers who can partner on evaluations and also to help policymakers apply the results of completed evaluations to their work. Third, we provide capacity building to help people better produce, use, and advocate for rigorous evidence. And at the heart of JPAL is our network of more than 150 affiliated professors. As you'll see on this slide, JPAL's affiliated professors sit not just at MIT, but at universities around the world. And what these professors all have in common is their interest in using randomized evaluations as a tool to answer critical questions related to poverty. Each dot on this map represents a randomized evaluation led by one or more of JPAL's affiliated professors. And you'll see at JPAL we think about poverty very broadly. So these evaluations span a range of sectors, everything from crime to education to health and labor. And in addition to our network of affiliated professors, JPAL also has a professional staff, including myself, who are based at JPAL's global headquarters and at 6 regional offices around the world, including JPAL North America, which is based in Cambridge at MIT. So JPAL North America launched our State and Local Innovation Initiative in the fall of 2015. And we were motivated by a challenge that is probably familiar to many of the folks on this call who either work for or with state and local governments. And that's that many state and local governments have developed innovative approaches to addressing complex policy challenges, but too often state and local governments don't have the resources or the capacity to rigorously evaluate which of these innovative approaches work or which work best. The goals of the State and Local Innovation Initiative are to help build the capacity of state and local governments so that they can create rigorous evidence about what's working in their own jurisdictions, and also so they can share this evidence with other jurisdictions that may be facing similar challenges. We also aim to document and disseminate practical guidance for how to feasibly implement randomized evaluations at state and local level, and how state and local governments can overcome some of the common challenges to designing and conducting randomized evaluations. Since launching the State and Local Innovation Initiative, we've selected 8 government partners, which are shown on this map. And these governments have partnered with researchers to develop evaluations on a range of topics. Just to share a few examples, The City of Philadelphia was selected in the first round of the initiative and has partnered with one of JPAL's affiliated professors to develop a randomized evaluation of the city's Work-Ready Summer Youth Employment Program. The state of South Carolina was another government that was selected in the first round of the initiative, and they've partnered with a team of researchers to develop a randomized evaluation to understand the impact of being assigned to different Medicaid managed care plans on both healthcare outcomes and healthcare costs. And in the second round of this initiative, we selected 3 local governments, the City of Baltimore, King County in Washington State, and Santa Clara County in California, all of which are working with researchers to develop randomized evaluations of programs aimed at addressing homelessness. And to support these governments, JPAL North America offers a package of supports which are designed to help state and local governments overcome common barriers to designing and implementing randomized evaluations. The first of these supports is matchmaking or connections with experienced academic researchers in JPAL's network who can help governments both design and then also carry out randomized evaluations. Second, we provide ongoing technical assistance from JPAL staff who have expertise both in research and in policy. And third, we provide flexible funding to help projects get off the ground, both smaller amounts of pilot funding as these projects are getting up and running, and then governments that have successfully partnered with a researcher from JPAL's network can later apply for larger amounts of funding to actually carry out the evaluations. I want to talk now about some opportunities for randomized evaluations that state and local governments can look out for. But before I want to note that while at JPAL our specific expertise is in randomized evaluations, which are also known as randomized controlled trials or RCTs, and while the State and Local Innovation Initiative is focused on supporting the use of randomized evaluations, this doesn't mean that randomized evaluations are the only tool available for measuring the impact of a program or policy. There are a number of other evaluation methods that can also be used to measure impact, and which of these methods is the right tool for you depends both on your particular program and also on the question that you'd like to answer. So at JPAL, we're very happy to speak with potential applicants to help you think through whether a randomized evaluation might be the right fit for your particular circumstance. I also wanted to pause for a moment and walk through what I mean when I talk about randomized evaluation. The key feature of a randomized evaluation is that before the program starts, eligible individuals are divided randomly into 2 groups. One of these groups is the treatment group, which receives access to the program, and the other group, the control group, does not have access to the program. And this random assignment can be done by flipping a coin or rolling a die or drawing names from a hat, but of course researchers typically use statistical software to do this random assignment. And because these individuals have been randomly assigned to 2 groups, we know that the groups are identical on average before the program starts. And importantly, they're identical both in ways that researchers can measure, so things like age or income, but also in ways that can't be measured, such as family support or motivation. Then the program is delivered, and at the end of the program, the researchers measure the outcomes for both groups. And again, because the 2 groups were identical at the beginning, and then the only difference is that one group has access to the program, we can be very confident that any later differences between these 2 groups represents the impact of the program as opposed to some other underlying factor. Now, of course, this is a simplified example, and one of the great things about working at JPAL is that we've seen that researchers can creatively design randomized evaluations in many different ways, both so that the randomized evaluation is answering the research question that you're most interested in, and also so that it minimizes the impact of implementing a randomized evaluation on the program or policy that you're interested in testing. So when Melissa and Corinne share the example of Stay the Course, they'll talk about some of the choices that the researchers made in that case, and I'm also happy to share more examples during the Q&A if that's of interest. As I mentioned, at JPAL, we're very happy to talk with potential applicants to the initiative or others who are interested in randomized evaluation to help you think through whether a randomized evaluation is the right tool for the research question that you're interested in or the program or policy that you're interested in evaluating. But I also wanted to talk about a few opportunities that you might generally want to look out for. The first is when a program is being piloted for the first time, and you can use random assignment to determine who gets the program first. This can be a very fair way of allocating who has access to the program, while also allowing you to evaluate how the program is working before deciding whether to continue or expand it. And similarly, when a program is expanding to a new location, often it's difficult to expand to everywhere or everyone at once for operational reasons. And in these instances, you can use random assignment to determine who will get access first. When a program is oversubscribed, such as when a program has a waiting list, random assignment can be a fair way of deciding who gets access to a program. I do want to emphasize here, we never want to deny access to a program solely for the purposes of doing an evaluation. But of course, as many of you know, unfortunately, too often programs don't have the resources to serve everyone who is eligible. And finally, when you're adding a new component to a program, that can be an opportunity to use a randomized evaluation to compare version A, the original version of the program, to version B with a new component added. And you can also think about testing version A, version B versus a control group that doesn't have access to any versions of the program. And at JPAL, we also try to help you determine when a randomized evaluation doesn't make sense, either for the question that you're interested in or for your particular context. One of the most frequent questions that we get in conversations with policymakers and researchers who are thinking about partnering on an evaluation is about the sample size, or the number of people who would need to be randomly assigned to the treatment group or to the control group as part of the evaluation. And this is an important question because you need a large enough sample size to be confident that any differences in outcomes are due to the program and not just to chance. Unfortunately, the sample size needed depends on a number of different factors, so it's hard to give a general answer to what the sample size needed would be. But randomized evaluations typically have sample sizes of at least a few hundred people. You also want to think about holding off on doing a randomized evaluation when it's too early. And what I mean by this is when a program is still ironing out logistics and the details of implementation. And the concern here is that if an evaluation finds out that the program had no effect, is that because the program could never work, or just because the program hadn't figured out the exact implementation yet? So in these cases, often we advise that programs start with a pilot and sometimes also a process evaluation before moving on to a randomized evaluation. On the other hand, it can also be too late to do a randomized evaluation. When a program is already serving everyone who is eligible and no randomized assignment or lottery was built in from the start, then you can't run a randomized evaluation after the fact. And finally, if a positive impact has been proven and we have the resources to serve everyone, then we should be putting our time and effort towards making sure that the program is reaching as many people as possible, or potentially thinking about scaling it up in other locations. And we certainly would never want to do an evaluation just for evaluation's sake. I'm going to transition now to Melissa and Corinne, who are going to share a specific example of a randomized evaluation in practice. I'm really excited to have Melissa Carney and Corinne Weaver joining me today to share this story with you. As I mentioned, Melissa is a professor of economics at the University of Maryland, and Corinne is the Director of Research and Evaluation at Cafeterias Fort Worth. Melissa is part of a team of researchers who partnered with Corinne and her colleagues at Cafeterias Fort Worth on an evaluation of an innovative program aimed at increasing degree completion among low-income community college students. And so I'll turn it over to Corinne now to tell that story with you.
Thank you so much, Julia. Thank you so much. So Cafeterias Fort Worth, for those of you who don't know, we are a large nonprofit organization in North Texas, and our goal is to end poverty one family at a time in our community. We have been in operation for over 100 years, and for much of that time, our focus was more on what we would call serving those in need, or more transactional services. So ones that were about kind of delivering a discrete service, or maybe it was financial aid, or it was a ride, or it was clothing to the families in our community. And over time, we realized that while those were incredibly beneficial services in some ways, they really weren't helping our clients to get to a place where they no longer needed our services anymore. And so in the past decade, we've really shifted our focus to be more about ending poverty for our families, so that they get to a point where they are self-sufficient and no longer need the support of Catholic Charities or any other nonprofit or government entity. And so in order to do that, we knew that we needed to have better a better sense of what was really working in our services. So we needed better evidence. We needed to understand our impact, and we needed to understand where it was working and also where it wasn't so that we could shift our resources around accordingly. Right around the time that we were making this shift internally, we were introduced to the researchers that Melissa works with at the Lab for Economic Opportunities at Notre Dame. And we basically met a group of like-minded individuals who were really interested in kind of being on the other side and helping nonprofits to really build up their, not just to produce that rigorous evidence, but to also help agencies like us build up our capacity to be able to make decisions based on the data that we're able to see as well, as you heard Julia speak about, that's something that JPAL does as well. And so we kind of thought this was a serendipitous meeting that we met this group right around the same time we were looking to do the same thing. And so we've been in partnership with the group at LEO since 2013. And today we're going to talk about the very first project that we launched together, which is called Stay the Course. And first I'll start with a little bit of the background about why we were particularly interested in beginning with Stay the Course. And so we know that community colleges are an effective way to help low-income students achieve the training and education they need to prepare for entering the labor market and particularly entering into living wage employment. However, we know not just nationally but locally with our clients we work with, there's a completion crisis. There are many more students starting community college than there are finishing it. And that can be financially crippling for a student in terms of student loan debt and things of that nature, but it can also be really kind of motivationally crippling. So for a student who has these great ambitions and goals to go to school and to finish and to get this great job, and then they aren't able to make it all the way through the program, that can really lead to sort of a demotivating factor for those students. And that's something that we, really don't want to ever see for anybody that we're working with. So we kind of dug into this a little bit more and tried to understand what are some of those barriers to graduation. And we came upon 4 main categories of barriers. The first being college costs, and the second being academic underpreparation. That we felt 2 things when we kind of saw those barriers. One is that there's been a lot of research into these areas already, but also those aren't areas where Catholic Charities Fort Worth is really well suited to kind of help students address those barriers. And so when we kind of kept digging and we came up with a couple of other obstacles, we really felt like this was our sweet spot and somewhere that we could really help intervene with students. And those barriers were around more of the institutional or kind of personal non-academic obstacles. And so what we mean when we say institutional obstacles is this idea that the college system can be complex, particularly for a first-generation college student who doesn't have parents or other guardians to rely on to help navigate that system. Further, although the community college might have counselors or advisors or other family support services in place, they tend to be under-resourced compared to the number of students who have needs within those systems. So you're talking about advisors or counselors with caseloads in the hundreds and maybe even thousands of students. And so the ability to provide kind of individualized one-on-one services is really limited. Further, in terms of personal and non-academic obstacles, or what we often just refer to as life, there's so much that happens outside of the school, or outside of the classroom, that can really get in the way of a student persisting in school. And so this is everything from, having to choose between making a tuition payment or paying the electric bill, or, experiences with substance abuse or domestic violence, or other, child care, transportation, all those things that really could prevent you from being able to get to class. And then, of course, there's just even the concepts around planning and time management, which we see for many of our clients. Those skills have just really never been developed at a younger age, and so they're entering a system that requires them to be able to self-manage their time and their commitments and their planning, and they don't yet have those skills. And so as a result of kind of this investigation and really understanding what we could offer from Catholic Charities, we designed Stay the Course, which is a comprehensive case management program that's really designed to promote college persistence and completion, but really to focus on those areas of institutional obstacles and non-academic sort of life barriers. And we do this through 2 primary components. The first is intensive case management, and that is really, we call them navigators. They're basically case managers, but the navigators are typically bachelor's level or higher individuals with degrees in social work, education, or other social service fields that are paired with a group of students. And so we typically have about 35 to 40 students paired to a navigator. And the navigator and student really get to know one another, identify goals to, academic goals, life goals, and then also they identify barriers to those goals that could be in the way of the student reaching their dreams. And then they build a plan. So they break that into an action plan. What are the concrete steps that this student can take in order to reach those goals, and how can the navigator support them along the way? And then there's regular check-ins that are being built into place so that the case manager and student are really interacting on a very frequent basis. We look for a minimum of every other week that they have a face-to-face interaction. The navigators are meeting the students outside of their classrooms. They're meeting them in the cafeteria. They're really just being a part of their life. They're part of their academic experience, so that the student really knows that they have someone that they can go to when things are getting tough and that they need some additional support. Those navigators are embedded within the community college setting, and then they are those staff of Cafeterias Fort Worth, so they're really well trained and versed in social services, but they're able to operate within the environment where the students are. And so that's the intensive case management component. The second primary component of STATA course is emergency financial assistance. And so this is basically financial assistance that the students are able to access for non-academic needs. And so these are the things like, paying an electric bill or a car repair, or potentially if they're getting a new job and they need to get a uniform or some clothing to wear to that job, we can support them with that. And the students have access to $1,500 over the life of the program, or up to $500 this semester. So the reason for that is that we really try to help the students spread out their access to the assistance over the course of the program. And so STATA course has been in operation since fall 2013, and we're currently at 2 campuses within our local community college, Tarrant County College. And this coming fall, we will be expanding to an additional 3 campuses in our area. Melissa is going to talk to you about the evaluation and some of the early outcomes that we've seen. But I'll just kind of highlight here that the role in the various partnerships is that Cafeterias provides the services, and we also do internal data and analytics to kind of help us in a more kind of real-time, on-demand way, know what's going well and what's not within the program. The LEO team at the Lab for Economic Opportunities really focuses on outcome evaluation and also on a process evaluation, which you heard Julia mention is basically helping us to understand how well the intervention is being implemented. And then Tarrant County College is really responsible for helping us to access space, coming and doing trainings with our navigators so they're well versed in the way the school operates. They also collaborate with us on just inviting us to different faculty trainings and staff meetings. They give us space at events so we can do marketing tables for the program so students can learn about our services. And then they also provide access to administrative data for the LEO team so that they're able to conduct their outcome analyses. So I'll pass it off to Melissa to talk about the evaluation design. But during the Q&A, if there are any questions about the program, I'm more than happy to address them.
Okay, so I'm trying to advance the slide, Julia. So I want to talk about the way we rolled out the evaluation. And so the RCT demonstration was rolled out in the fall of 2013 at the Trinity River campus of Tarrant County College. And this was a new program that Cafeterias Fort Worth was launching. So doing this at one campus was the best way to roll out and test the concept of a new program. And the universe for the sample consisted of the 8,849 students who were currently enrolled at the campus. And the first thing we had to do as a research team was determine the RCT sample eligibility. And what was critical for this piece was that the campus was willing to work with the research team in terms of looking at student outcomes to determine eligibility. So the TCC Office of Institutional Intelligence and Research, and I will just refer to them as the Campus Research Office going forward, they did the extraction of data necessary to identify the eligible sample. And the eligibility for the research project was based on income and enrollment so that we could target the program to low-income students who were enrolled in a sufficient number of credits at the outset that they might feasibly be expected to complete a degree in 3 years. So what we didn't want to do was have a whole bunch of students who were just on campus taking a class or two without the intention of actually getting a degree. Okay, so once we looked at the data and figured out which of the enrolled students were eligible for this program, we were left with a final study sample of around 1,200 students. The research team then took the data on this sample of eligible students, and we randomly assigned each of them into one of three groups. 430 students were offered the stay-the-course treatment, which Corinne described. 299 students were assigned to the emergency financial assistance only treatment group. And then 439 students were assigned to a control group. And importantly, the students in this control group, they received no additional services, but they, of course, had full access to any existing college or community services. You know, as Julia said at the beginning, we'd never want to deny somebody additional services. It was just that we didn't have the funding to give everybody stay the course, and so we randomly assigned a couple hundred students to have access to that comprehensive program. And the reason we included two treatment arms, both the stay the course treatment arm and the emergency financial assistance only, was so that we could determine in a research sense how much of any observed effectiveness of the fully implemented program could be achieved with only, let's say, financial assistance, because obviously that would be less costly. So after randomly assigning each eligible student to one of those three groups, we notified the college of the results, and the college then sent specific emails and letters by regular mail signed by the college president. So hopefully you're picking up on the fact that this was really a partnership, as Corinne described, between the Catholic Charities, navigators, the research team, and the campus. And really without the support of the campus, this just wouldn't have been, we wouldn't have been able to do this. So they actually sent the official notification to the students, which we expect would be really important because then the students knew this was a legitimate program that the campus was, in essence, happy to have on campus. And so in those communications, students were directed to a web page where they could electronically sign a consent form for services and enroll in the program. Of the 430 students who were offered participation in the Stay the Course treatment arm, 94 students completed the intake process to enroll. So that's a take-up rate of 22%. The Emergency Financial Assistance treatment arm had a 42% enrollment rate. So there's two things I want to point out about that. First, to identify the causal effect of this program on student outcomes, which is the goal of our research project, it was really important that we not just compare students who decided to take up services versus those who don't. And this is something that Julia was mentioning at the outset. You know, for the purposes of a rigorous evaluation, we really want to compare the students who were randomly assigned to have access to the program versus those who are not, and it's that random assignment that allows us to be sure that any difference we observe in subsequent outcomes is due to the effects of the program, not to unobserved characteristics of the student that led them to enroll in it, like their commitment to completing school, for example. Okay, the second thing I want to point out is that the low take-up rate of the Stay the Course program, remember I said only 94 out of the 430 enrolled, we think that that was a feature of the way we rolled out the demonstration project. So specifically, as I described, we had randomly assigned students to a treatment or control group and then invited them via the mailed letters and emails to visit a website and enroll, and some of them just never bothered opening the email. So in a second phase of the RCT, which Corinne and I are not talking about today, we reversed the order, invited all eligible students to visit a website and enroll, and then after they enrolled, we randomly assigned them to a treatment or control group, and that reverse procedure led to a take-up rate of 87%. So that's a lesson that we learned in terms of how to more effectively roll out an RCT project like this. Okay, next slide. Okay, so our study relies on administrative data provided to us by the campus. And the way it would work is that a few months after the end of each semester, the research office at Tarrant County College would send the research team a file on all the study students, and that file included information about their enrollment status, course completion, degrees and certificates earned, course results, as well as demographic information about the students, including the student's age, race, ethnicity, family, income, among other characteristics. And so then we, the research team, also linked those campus records to data from the National Student Clearinghouse, which is a nonprofit organization that collects student enrollment and degree completion data for more than 3,600 post-secondary institutions, covering 98% of all post-secondary students in the U.S. And for our purpose, this linkage allowed us to observe whether a student transferred to a 2- or 4-year college and potentially completed a degree at another post-secondary institution. So having access to this additional source of data and making that linkage was really critical, because if one of the students from Tarrant County College transferred to another school, they would no longer be in the TCC administrative records, but it would be misleading to code them as a college dropout. Okay, so having that data, what did we learn? Well, the results of the study are quite promising. So the empirical results, which we got with our econometric techniques, they indicate that students who were randomly assigned to receive stay-the-course comprehensive case management had significantly higher rates of persistence and degree completion, especially among female students. And so in a statistical sense, the estimated effects for the full sample are imprecise, but when we just look at females and we compare those women who were randomly assigned to stay the course versus the control group, we see a 7.4 percentage point increase in the likelihood of earning an associate's degree. And that compares to, in the control group, 16% complete an associate's degree. Okay, so that's what we call as researchers an intent to treat effect, because this was just all the women who were assigned to have access to the program, and we know most of them didn't take it up. So if we scale by the percent of females who actually took up the program, that gives us what's called in the evaluation literature a treatment on the treated effect of 31.5 percentage points. Okay, so that's a really big increase, I mean, quite large increase in graduation rates. 31.5 percentage point increase in the likelihood of completing a degree, as compared to, remember, I said the control group, their completion rate is 16%. So really encouraging. We still need to think about why perhaps the program doesn't appear to have been as effective for men, and that's something that hopefully future research can help us understand better. But one way to put the overall impacts into context is to compare the economic benefits of the program to the program costs. And so we offer a back-of-the-envelope calculation to get a handle of sort of benefits versus costs. We use national data on how much people with college, community college credentials earn as compared to those with just a high school degree. And using those earnings differentials as a basis for our calculation, we find that the earnings gains that we can expect from the program, given the results we find in persistence and completion, exceed program costs in just over 4 years. So this is a really socially beneficial project for community colleges and nonprofits to undertake. I'll also note quickly that we find no difference in outcomes for the emergency financial assistance only treatment group and the control group. So what that indicates to us is that to have a positive impact on student persistence and completion rates, it's not enough to just give students cash to cover an unexpected financial obstacle. It seems that having the case management is really critical. So next steps, this is, really promising first study, but by no means is this the final word on the program. We intend to continue working with Catholic Charities Fort Worth to roll this out on other campuses, to link this data to longer-term outcomes so that we can observe ultimately what happens to the earnings of students who were assigned to the program versus not. We want to replicate it on other campuses to make sure that what we found in this implementation wasn't just because this particular set of navigators was really effective or they matched particularly well with the students on this campus. We want to make sure that this program can be implemented in other settings and also deliver this kind of result. So I'll stop there and turn it back to Corinne to give her take on how Catholic Charities Fort Worth is using the results of the study.
Great, thank you. So we have really learned a lot from this partnership. I think one of the biggest lessons we learned is the importance of monitoring program implementation in real time. So Melissa just shared with you, 3-year results that show, great persistence and completion. And we had some really early results that were also positive. There was a period of time, though, in between there where the outcomes took a little bit of a dip, where the treatment group was starting to look more similar to the control group. And when that happened, you know, the first thing we did was really dig into our implementation data to understand, was there something about the way the services were being provided that could have explained that? And we learned that that was probably what was going on. As the second year of the program, some of the intensity had started to slip. We weren't as diligent about meeting with students in a face-to-face or more meaningful way as often, and there was more kind of mass email and text communication occurring. And so when we realized that, we put into effect a couple of program changes. One is that we identified what is our kind of minimum expectation of communication between the navigator and the student. And then also, you know, what are some quality supports we can put in place to make sure that it's not just frequency, but it's also quality of interaction. And then once we had determined those kind of baseline metrics, we then put in place an ability to monitor them in real time. So we, you know, this wasn't that long ago, but unfortunately we were in paper files not too long ago, and so we began using a centralized database. We built in the ability to monitor those metrics through real-time reports and dashboards. We broke those reports and dashboards down so they could be at the program level, but they could also be at the individual navigator level. So any single navigator would be able to pull up a report that shows them kind of how they're doing against their goals, kind of where their weak spots are. And it also allowed the program manager to be able to help. They would meet with their navigators weekly for supervision to really talk through some of their tougher cases, what are some of the engagement challenges, things of that nature. And so, you know, our outcomes, we kind of would have thought, great, everything's going well with the program. We got some outcomes to indicate otherwise. We took a deeper dive into our work, thought we needed to make some changes. We made them, and then we saw how effective that was in getting the outcomes where we wanted them to be for stay the course, that we were able to take a lot of the lessons learned from that experience and apply it to other programming within Cafeterias. And so on the whole, we've really just been able to build up our capacity to be a data-driven organization. And we've also built up our capacity to be able to understand where to invest our resources. So this idea of getting comfortable with learning that things may or may not be working, so that you can really make sure that you're doubling down on what is and that you're either modifying or doing away with the things that aren't. And so we've really kind of just caught the research bug here at Cafeterias Fort Worth, and we've actually built up an internal program evaluation and data analytics team that really helps us to, before we're ready for the rigorous outcome evaluation that Melissa and her team does, we're able to kind of do more internal, shorter-term program evaluation so that we can get our programs to the best shape they can be before we layer in this external piece as well. So just all in all, it's been a really great learning experience for us. And if anybody has questions during the Q&A, I'll be happy to address them. But I'm going to pass it back now to Julia.
Great, thank you so much, Kern and Melissa. And as Kern mentioned, Melissa and she are happy to take questions during the Q&A. So as a reminder, please feel free to enter any questions you may have in the chat box at any point. But in the meantime, I wanted just to close by talking a little bit more about the State and Local Innovation Initiative and how governments can get involved. So as I mentioned earlier, through the JPAL State and Local Innovation Initiative, JPAL offers a package of supports which are intended both to help state and local governments launch specific randomized evaluations that can inform their policy questions, and also more broadly to help them do exactly what Kern talked about and build up their capacities for using data and evidence to improve their work. So we do this by hosting a two-phase competition where in phase one, state and local governments can apply for technical support from JPAL staff, flexible pilot funding of up to $100,000, as well as matchmaking with JPAL's network of researchers. And then in phase two, governments that have partnered with a researcher from JPAL's network can apply for larger amounts of funding to carry out the evaluation. And JPAL is now inviting letters of interest from state and local governments that are interested in participating in the initiative. I want to emphasize here that first, JPAL defines poverty alleviation very broadly, so we are open to letters of interest across a wide range of policy areas, including education, employment, healthcare, crime, and housing. But certainly, if you have a question about whether your idea would be a good fit within the initiative, please feel free to contact me. And I also want to emphasize that the goal of this initiative is to identify the questions that state and local governments are most interested in answering. So when you're thinking about preparing a letter of interest, we ask you to start with describing the policy question or challenge that motivates your application and the program or policy you would like to evaluate. And then at JPAL, we're happy to have conversations throughout the application process to help you think through whether this is a good fit for the initiative more broadly and also for a potential randomized evaluation. We also ask in your letter of interest for you to share some additional details that help us get a sense of whether a randomized evaluation might be feasible. So things like the potential sample size or how many people are currently reached, the potential opportunity, any initial thoughts you have on how a randomized evaluation could work, as well as access to data for measuring outcomes. But this is certainly, as I mentioned, a conversation, and we're happy to speak with you if you have questions about how to answer those specific questions or if you'd like to talk through a potential idea. The timeline for the application process is here, so I want to flag that the deadline to submit letters of interest is coming up on March 2nd, and in April we'll invite a small group of finalists to submit longer proposals, providing some additional detail on their ideas, with winners announced in August. If you want more information on the application process or if you'd like to download the request for letters of interest, please visit our website. It's povertyactionlab.org/state-and-local. Great. I'm going to turn it over now to the Q&A. Again, if folks want to answer, if folks want to ask questions, please feel free to enter them at any point through the chat box. I'm happy to answer any questions about the initiative or the application process. And Melissa and Corinne are here if you have any questions about Stay the Course or their experience partnering on an evaluation. So I wanted to start with a question that just came in through the chat box. So someone asked, what are some ways to get information about a program out to people where it is not as easy to get contact information? So I can start on this, and then Corinne and Melissa, please feel free to jump in, since it sounds like you've had some learnings on this through Stay the Course. So just to start, I mentioned that one good opportunity for a randomized evaluation is when a program is oversubscribed or has a waiting list. But the flip side of that is sometimes it's possible to do a randomized evaluation when a program is undersubscribed or there's low take-up, and that can actually be an opportunity to test different strategies for reaching out to individuals to see which is most effective. So to give a few examples, researchers in JPAL's network have tested out this approach in an evaluation that looked at ways to encourage SNAP take-up among low-income adults who are likely eligible, as well as the Federal Weatherization Assistance Program. So for example, you could provide some people with text messages and others with postcards and see which is most effective at encouraging take-up. Melissa and Corinne, do either of you want to talk at all about how you approach this, either through the evaluation of Stay the Course or in some of your other work?
This is Melissa. I can add that this is the type of thing that's going to be really specific to each project, and having a committed partnership really helps. So like in our case, we really needed the college to help get the word out to students so that they knew that this was a sort of legitimate project. In other RCT applications that researchers have done, I can think of one off the top of my head where they were trying to connect with parents of preschool-age children, and they literally had research assistants sort of standing outside preschools giving letters to the parents. So sort of a brainstorm between the practitioners and the research team. This will be one of the first things to be figured out.
That's great. Thank you. Another question that came in through the chat box is asking us to talk a bit about the programs that were selected last year and why. So last year we selected 3 local governments, 1 city government, and 2 county governments out of more than 25 letters of interest that we received. And I think there's a few primary criteria that we used in selecting the letters that I can briefly walk through. So first I should say that, for this competition, for the 2 rounds that we have held so far, we have been over capacity in terms of getting more great ideas than unfortunately we can fund. But we're always happy at JPAL to see whether we can still connect applicants with researchers in our network to pursue an evaluation on their own. And in some cases, those connections have led to successful partnerships. In terms of the proposals that we did select, I think what stood out was, one, a commitment from the government to using data and evidence to inform decision-making. So as I mentioned, we never want to do evaluation for evaluation's sake, but always with the goal of hopefully learning something new that can inform policy and improve the lives of the people that the government is serving. And then second, as I mentioned, there has to be a feasible opportunity for a randomized evaluation. And so we look at things like the potential sample size and the access to data to measure outcomes. And then the final thing I'll mention is that one of the goals of this initiative is to share evidence across jurisdictions that are facing similar challenges. So generally, we look for governments that are interested in exploring a research question that is facing not just one particular government, but many across the country. So I mentioned the government selected last year were all looking at different programs and policies aimed at addressing homelessness, which is obviously a common challenge across state and local governments in the U.S. Someone else asked to talk a little bit more about Phase 1 and Phase 2 and the application process for that. So to answer that question, Phase 1 is, I would think about as the phase during which you would work with a researcher to develop initial ideas for a randomized evaluation, and then ultimately, if a randomized evaluation turns out to be feasible, to design the evaluation. And then Phase 2 is when you're partnering with a researcher to actually carry out that evaluation. So in terms of the letter of interest, what you want to do is outline your ideas for the research question that you'd like to answer in Phase 1 and the program or policy that would be evaluated and some of the details of that program. And then once you were selected and partnered with a researcher, you would work with the researcher jointly to apply for Phase 2. So that application process comes typically about 6 months to a year later, depending on sort of what stage the governments are at when they first apply. And another question we got was about how governments can use the pilot funding, and specifically whether they could use the funding for digitizing data that would be used in the evaluation. And as I mentioned, the pilot funding that's available through this initiative is very flexible, and the idea is that you can use it for anything that's needed to get the project off the ground. Typically, this is probably obvious since the evaluation funding is capped at $100,000, that funding is not sufficient to cover the cost of the actual program that's being delivered unless it's something very low cost like sending letters or text messages. But we're happy to pay for things such as data collection or building data systems to measure outcomes. Oftentimes the pilot funding is used for staff time that's needed to project manage the evaluation and to work with the researchers and in some cases also the service provider to carry out the evaluation. It can also be used for travel, both to help research partners come visit the site and also for travel of different project partners, and the cost of developing or testing survey instruments. So those are just some more examples. If you have specific questions, please feel free to reach out. Another question that we received is whether JPAL could be an evaluator in partnership with other academics. So in order to receive full evaluation funding as part of this as part of this initiative, a state or local government has to be interested in partnering with a researcher from JPAL's network. One thing to clarify is that JPAL itself is typically not the evaluator on the project, but rather we have a network of academic researchers who sit at different universities. So for example, Melissa, as I mentioned, is at the University of Maryland. It's often the case that researchers that are part of JPAL's network will partner with other academics. So sometimes this looks like a researcher from JPAL's network who has specific expertise in randomized evaluations partnering with another researcher who has specific expertise in a topic area, or another researcher who might be local to where the evaluation is taking place, and all of that is perfectly fine. The flip side is that this initiative is looking to provide a package of supports, which includes the funding, the technical assistance, and the connections with researchers. So if you already have connections with researchers, if you don't need additional technical assistance from JPAL, then this probably isn't the right fit for you. Another question that we received is when we talk about access to data for the evaluation, what kind of data does that mean? So I can talk a little bit about this, and Melissa and Corinne, feel free to jump in if you have examples to share from your work. So the data that you need really depends on the research question that you're trying to answer. Typically at JPAL and among evaluators, we think about two different kinds of potential data sources. So one is survey data or other kinds of original data where the researchers are actually going out and asking participants both in the treatment group and the control group about their outcomes. And the other kind of data is what Melissa mentioned, which is administrative data. And that's data that is already being collected for the purposes other than an evaluation. So in the state of course example, Melissa mentioned that they're collecting data from the community college on things like credits earned in degree completion. The benefit of using administrative data in evaluation is that it's often much less expensive because you don't need to hire separate survey staff to go out and track down participants. It can also be logistically easier for that reason. And in certain cases, you can get the data much faster because the data is already being collected as you go along rather than having to go out and do that at the end of an evaluation. So that is one thing that we look for, is whether you have access to administrative data, things like test scores, hospital records, school records, police data to measure outcomes. But what those specific outcomes can be really depends on the program that you're interested in testing. And then another question we had, and Melissa, maybe you could jump in here, is what about PII, so personally identifiable information, or HIPAA concerns in regards to the data? Could you talk a little bit, perhaps, I know HIPAA wouldn't have applied in this case, but how you thought about privacy and data sharing for the state of course evaluation?
Sure. So the governing principle when you're looking at student records is FERPA, which is sort of like the analog to HIPAA in this context. And certainly our project and all, schools who I think would be working with researchers would make sure that any data that was shared satisfied those government privacy restrictions. So we would never, as a research team, have access to information that would allow us to go find a particular student. It's just important that there are like record identifications so that we could link a student, for example, to this external administrative record data. But so, yes, all sort of universities that researchers worked at, we have to go through IRB restrictions and have our project approved to make sure that all of the necessary safeguards are there to protect the privacy of anyone whose records are being shared as part of a research project.
Great, thanks. So we're coming now towards the end of the hour, so I want to pause here and thank everyone for joining the webinar today and for your very thoughtful questions. I know there were a few questions that I wasn't able to get to. Please feel free to follow up with me, and I'll have my email address on the last slide. And if you have questions for Corinne and Melissa, please feel free to send those to me as well, and I can pass them along. If you'd like to learn more about JPAL and our state and local innovation initiative or about our other work, please feel free to visit our website. It's povertyactionlab.org. On this slide, I've highlighted just a few of the resources that we have for folks that are interested in learning more about randomized evaluation and topics like administrative data. As I mentioned, we'll also be posting the webinar recording and slides on our website in about a week or so, so please feel free to look for those there. And to close, as I mentioned, please feel free to reach out to me either if you have specific questions about the State and Local Innovation Initiative or potential proposal, or if more generally you'd like to learn more about the work that we do at JPAL. So thank you again to everyone for joining, and have a great afternoon.